ओम धम तन्वंतरे नमः। रागादिरोगान् सततानुशक्तान् अशेषकायान् प्रसतानशेषान् औत्सुक्यमोहानतिदान् जघान योपूरवैद्याय नमोस्तु तस्मै. Let me share. Today's topic is MRI study of the brain. Magnetic resonance imaging study of the brain. We can use this tool to diagnose the pathologies in the brain, like hydrocephalus, cerebral hemorrhage, aneurysm in the cerebral arteries, and other tumor conditions. So this is a film of MRI of brain, and different slice the picture is taken. Magnetic resonance imaging is a non-invasive technique doctors use to diagnose medical conditions. MRI uses a powerful magnetic field, radio frequency pulses, and a computer to produce detailed pictures of internal body structures. MRI does not use radiation or X-rays. Detailed MR images allow doctors to examine the body and detect disease. Currently, MRI is the most sensitive imaging test for the head, particularly the brain, in routine clinical practice. Indications of MRI brain is developmental anomalies, hydrocephalus, dilatation of the fluid spaces within the brain, that is ventricles, causes of epilepsy like seizure, infections, stroke, brain tumors, certain chronic conditions such as multiple sclerosis, hemorrhage in selected trauma patients, disorders of the eye and inner ear, disorders of pituitary gland, vascular problems such as an aneurysm, let me say, bubble-like expansion of the vessel, arterial occlusion, blockage, or venous thrombosis, a blood clot within the vein. Precautions while taking MRI. So we have to avoid, we have to remove jewelry, watches, credit cards, and hearing aids, which can be damaged. It can remove pins, hairpins, metal zippers, and similar metallic items, which can distort MRI images. Removable dental work, pens, pocket knives, and eyeglasses, body piercing, mobile phones, electronic watches, and trick packing devices. This we have to remove. Also, we have to remove, if we have to see that some cochlear or ear implants. It's not renegade, is it? Some types of clips used for brain aneurysms. Some types of metal coils placed within blood vessels. Some older cardiac defibrillators and pacemakers. Vagal nerve stimulators. Let us see the mechanism, how the MRI works. Unlike X-ray and computed tomography, CT exams, MRI does not use radiation. Instead, radio waves realign hydrogen atoms that naturally exist within the body. This does not cause any anatomic any chemical changes in the tissues. As the hydrogen ions atoms return to their usual alignment, they emit different amounts of energy depending upon the type of tissue they are in. The scanner captures this energy and creates a picture using this information. In most MRI units, the magnetic field is produced by passing an electric current through wire coils. Other coils are inside the machine and in some cases are placed around the part of the body being imaged. These coils send and receive radio waves producing signals that are detected by the machine. The electric current does not come into contact with the patient. The computer processes the signals and creates a series of images, each of which shows a thin slice of the body. Radiologists can study these images from different angles. MRI is often able to tell the difference between diseased tissue and the normal tissue better than X-ray, CT scan, and ultrasound. Now let us see the benefits of MRI. MRI is non-invasive imaging technique that does not involve exposure to radiation. MRI can help physicians evaluate the structures of the brain and can also provide functional information, that is functional MRI in the selected cases. MR images of the brain and other cranial structures are clearer and more detailed than with other imaging methods. This detail makes MRI an invaluable tool in early diagnosis and evaluation of many conditions, including tumors. MRI can detect abnormalities that might be obscured with other imaging methods. And the MRI gadolinium contrast material is less likely to cause an allergic reaction than the iodine based contrast materials used in X-rays and CT scanning. A variant called MR angiography MRA provides detailed images of blood vessels in the brain, often without the need for contrast material. MRI can detect stroke at a very early stage by mapping the motion of water molecules in the tissue. This water motion, known as diffusion, is impaired by most strokes, often within less than 30 minutes from the onset of symptoms. This you see the doctor or the technician, the doctor observes the MRI images in the computer screen and locates the site of pathology. Another film showing the MRI. MRI is taken at different slices. The picture is taken. So we can, if you the knowledge of normal anatomy, normal structure should be there in the doctor. Where doctor should have the normal structures knowledge so that he can compare the pathology in the MRI. Another MRI is surgical section. So we can see the structures of the brain, the gray matter, white matter, nucleus, ventricles, medulla oblongata. So you can see the MRI of the brain. So In the right side, you can see a different slices. The structures of the brain are visible, and the doctor can read or a radiologist can locate the site of pathology and the type of pathology. You can see also in the eye area, so eyeballs, nasal septum, nasal structures, and sinuses, sinuses are all visible in the MRI. This is another field where the pathology can be located. So the structures are differentiated: ventricles, corpus callosum, etc. So medulla oblongata, hindbrain, cerebellum are visible. All are visible. The lower film, the lower scan, you can see the maxillary sinus, nasal nasal structures also. This is another film where you can see a different sagittal section. The structure of the brain can be visualized. Okay. Medulla oblongata are also. This is another film where you can see in different slices. The horizontal plane, you can see structures of the brain. The both hemispheres are visible. This is an MRI machine. You can see the bed where the patient lies, made to lie, and the circular apparatus, machine with the coils, electrical coils are there producing magnetic field, isn't it? The body is made to enter into that circular apparatus. So the structures is seen in the computer screen at various slices. The structures of the brain can be visualized, and we can locate the site of pathology and nature of pathology. Even the clot in the arteries of the brain can be tumors can also be detected. See in the sagittal section, there is a brain and the spinal cord, and also the parts of the head, structures in the head can be visualized. In this film, you can see the multiple slices of brain and different sites, different areas, isn't it? You can locate the nature and site of the pathology in the brain. This is seen in the computer screen. It can be printed and can be the hard copy can be got where it can be used. There's a field where the different slices brain can be mapped, okay, visualized. You see behind there is a MRI apparatus there, and in front of that doctor is studying the field of MRI. So you can see the brain in the frontal plane. Okay, frontal. So you can see the gray matter, white matter, nuclei, ventricle, corpus callosum, medulla oblongata. This is another field where multiple slices of the brain, different levels, can be visualized. This is another field which shows the brain at the horizontal plane, also and vertical plane. So later, there are different slices. The brain can be studied. This is another film which shows the brain structure, the MRI. This film where you can see the brain in the sagittal section, also horizontal section, frontal plane also. horizontal plane. You can see the brain structure. You can visualize the eyes of eyeballs, nose, the structures of the nose. It can also be ear, etc. Even the inner ear pathologies can also be detected by MRI. This is another film where you can see the structures of the brain, the horizontal plane. This is a film of the MRI where you can see the horizontal plane somewhere in the eyeballs. The the film of the slice, very clear. This is the brainstem also. This is another film where you can see different slices of the brain. So here also data is also edited. Date and time of scanning, patient's name, the sizes of different structures also visible or written and studied. This is a film where you can see the structures of the brain, also eyes, etc. This is another film which shows the brain structure. So by MRI, you can visualize, you can locate the site of pathology and can study the structures of the brain. This is a film where you can see the structures of the brain, spinal cord, brainstem, etc. Both in sagittal section, horizontal plane. This is a film where you can see the slice of the brain. There are different slices of the brain where you can locate the pathology. So you can study it and you can see whether it's normal or some pathology is there. Normal anatomy the doctor should know the normal anatomy of the brain so that they can locate the site of pathology and type of pathology. So in hydrocephalus, the ventricles will be dilated. So today we have studied the MRI of the brain. Thank you for patient hearing.